You're listening to the Business of Pharmacy podcast with me, your host, Mike Kelzer. Flaviu, for those who haven't come across you online, introduce yourself and tell our listeners why we're talking today.
My name is Flaviu. I grew up in North Carolina, small town, and after going to school for economics and technology, I met a friend who's a pharmacist and dove right into the world of pharmacy. This was back in 2011 outside of Charlotte, North Carolina. We thought the two of us would embark on the journey to transform the world of pharmacy through technology. And we were young and naive, and we walked into Amina Abu Bakar's pharmacy. If you know her, she's an awesome pharmacy owner and lived right down the road from where I lived.
Is that right?
Yeah. And so I walk in and I'm like, look at all these ideas, and we could do this on an iPad, and we could do this on, it'd be amazing. And you guys don't need to use these technologies, and told her all of our ideas of how to change pharmacy. And then she said, look, no. Here's what you need to do. Like, all you're saying is not real. Here's what's real. And learn about some of the challenges in pharmacy with PBMs that exist to this day. And that became the spark that started Medicare, which is a company now known as Amplicare, which we scaled to, I think, over 10,000 independent pharmacies use that platform today to help independent pharmacies, to help seniors save money on prescriptions, usually by finding better Medicare plans that better cover their prescriptions. So that's what we did. We were very fortunate to grow that over a decade, and eventually sold it, and really saw that the issues that we're trying to solve 10 years ago still persist. You know, these PBMs didn't go away. If anything, they gotten stronger. And while we helped give some weapons to the pharmacy to fight against them, the war hadn't changed. And honestly, our side is kind of losing. And that's not okay. And so we thought we got to do something. You know, we're in a position to still make a difference. And so we saw how a lot of the big chains like CVS, right, bought Aetna, as you know, Express Scripts and Cigna merged. You know, Walgreens is partnered with United, Walmart with Humana, and our people, right, the 21,000 independents, they have nobody. And that's not okay. That's not fair. In fact, they do a better job than the chain, and yet everybody's trying to switch every patient and send them to mail order and drop ship 90-day supplies on their doorstep. And that's not what we believe healthcare should be for our own, citizens. So we started Troy to be the plan for the little guy. Just like CVS has Aetna, Troy is for the independents.
Why'd you sell Medicare? Was it the right time?
Yeah, so this is the first time talking about this. So I hope I don't get in trouble with my co-founder or with the investors.
If you say something here, you be sure to tell me right now, or even if you think of it tonight, or if you listen to the recording, if you want to beforehand, be sure to let me know. I want to make sure you're real comfortable.
Look, man, transparency is our core value, so that's what we're about. Amplicare had grown, had kind of matured.
Under your control, was it always still Medicare, or had it switched to the Amplicare name?
Yeah, it had been switched. So we tried to expand beyond doing just Medicare plan comparisons. And so the name Medicare was kind of pigeonholing us into that thing.
I gotcha. Okay.
So we launched Amplicare, launched a few more products, honestly, to compete with Prescribed Wellness and some of the other software tools out there.
Okay.
And we got a couple of new board members. And I think after a couple of years, I've always been obsessed with the Medicare side of things. Mm-hmm. With, again, like what we talked about before, I just didn't feel right that we were helping independents, yet all these chains had their plan. And so we helped compare plans, but the options were getting fewer and worse and worse. Yeah. And so it's just, honestly, this has been on my mind since we started on Medicare. And I've always kind of been like, hey, let's build a plan.
Is it fair to say you got rid of Medicare because you wanted to do some other stuff?
Yeah, I wanted to start a plan. And look, I love my co-founder. Matt, and he very intelligent said, look, we can't build a plan within this company. Like, this is a totally different thing that requires different capital, different risk, different everything.
The iMedicare is really supposed to be non-biased. Neutral.
Right.
So you couldn't start one while you still had your fingers in that.
Exactly. So that's, I just had a heart-to-heart with him and said, look, man, I'm just so obsessed by this thing that I can't live another day without trying. So in 2018, I stepped away from the business. He became, CEO and ran it and did a great job. I stayed on the board, but really since 2018, and we only sold in 2020, right? So 2 years I was out of the business before. So the selling decision was really more of at that point I was already out of the business. So when they came with an offer, Matt and I and the board looked, is this a good deal or not? And it became more like a decision on, hey, I on the one hand needed the funds because Troy required so much capital to get off the ground that we were like the plane was getting really close to the ground and we needed a little jet fuel.
Right.
So I was all in favor for, like, man, I need this money to make sure that Troy stays alive. So I voted for it, and I think Matt felt it was a good outcome for him too. So that's why we sold.
If your idea was not into Troy or getting on the other side of things, would you still be there now, do you think? Were you enjoying that enough, or was it getting time to move anyway away from there?
It's hard to know, obviously I had this obsession, but you're saying if I didn't.
If you didn't.
Probably. I think so. Though I do think all companies tend to have a little life cycle, just like people. We grow up, we get old, and then eventually we die.
For sure.
And I think businesses are the same way. You can only keep a business and that passion, like burning the midnight oil. I mean, the early days, I was working 21-hour days
for sure
for years.
Yeah.
So eventually, I do think you run a little out of steam. Although once a business mature, definitely requires less of you. So I definitely think I probably could have, still been around, but it wouldn't have been something that I put 20-hour days into,
Your background, your formal background, you've got business studies, but do you have computer in your background? I saw you had a Ruby on Rails certificate and so on. Do you have official computer in your background too?
Yes. So after college, I did a master's in computer science, and in Charlotte, I actually helped run the Python meetup. Python is a programming language that is popular now. It wasn't so popular back in 2010, but it was like only 5 cavemen that came out every month to eat some pizza and cook. Yeah. So, and crazy story, I was running this thing, and actually the guy I met was kind of sponsoring because I didn't have money for the pizza. So this guy was giving us money for the pizza. And one day we didn't have a location. So I was like, I just messaged the group, hey, we don't have a location today. Let's just meet in a coffee shop down the street, which I was just going to go there, expecting really nobody to show up, honestly. I was just going to chill there for a bit. And this guy comes out of nowhere, and literally at my table, there's like 20 tables there, and he comes to me and he's like, is this the Python meetup? I'm like, who are you, man? Like, how did you find me? And he's like, oh, well, I'm Matt Johnson. I'm a pharmacy school down the road, and I'm really passionate about Python, and I'm working on this project, and I want to get your feedback. I was like, man, this is not somebody you meet every day.
Right.
A pharmacist that's a programmer that's like really into it. So that's how I met Matt, and that's how I eventually ended up getting together and starting iMedicare.
When you and Matt then met Amina, were you searching her out?
She just happened to be the closest pharmacy to where I lived. In like this, I had a roommate was living in this, half of a townhouse. I remember because she had just joined PDS and was telling us, you should go to PDS. And we're like, man, the fee is like $3,000. There's no way we can go to PDS.
Was that because of iMedicare that her name came to be in more prominence?
No, I don't think it's because I met her. I think it's just because
of who she is.
Exactly who she is. In fact, she didn't even sign up for the program until years after. A lot of the early adopters were really skeptical of the two of us doing anything useful in the foreseeable future.
A plan like that, iMedicare, it's kind of like as pharmacists started realizing over the years how terrible the PBMs were. It's kind of like you guys are like a firing squad and you're saying, which bullet would you like? I mean, all of the options started to not be real good, right?
It's true. It's true. They're getting worse.
Would any of this have happened without your love of computers? Was that part of the answer that you said, I have some answers, but I can bring those answers out with computerized something? Was that a big part of it, that skill you had?
Yeah, I think so. I think it's a tendency to want to hack things. You know, like when you're a little hacker to try to piece something together. And so I think that's what attracted me to technology in the first place.
Gotcha.
And then I was working on different tech stuff. And, this is early days, social network stuff. And you're working on, photo apps and these things that are all, cool, but they don't really change the world. It didn't feel like I was really making a difference. And as I met Matt and I learned more about pharmacy, he actually learned more about technology. I learned more about pharmacy. And it just struck me like there's this massive unfair system built that I became obsessed with kind of hacking to figure out, like, why is it that you have these little guys doing a great job here and these big guys just beating them up every day, and it just didn't feel fair. And so that's, I think, underlying it all, is just that feeling of hacking it.
So the underlying skill was the hacking, and then it didn't hurt that when you had some answers, you could probably categorize it and think, how could I do this program-wise and so on?
Exactly. You got it.
On this program, I always talk about how much partners suck, but I can see that you and Matt definitely were a symbiotic relationship for your business. And so now when you pulled out of that, would you consider yourself that you had any partners when you started Troy, or was that really you were the sole person on that versus having a partner when you had Matt?
I'm a strong believer you need a partner because it's so lonely doing this by yourself that you gotta have a person to live the highs and the lows with.
Oh, that's interesting.
And so when we started, honestly, I wasn't, despite being obsessed with the idea for a decade and telling everybody about it. I'm sure people know from conferences hearing me talk about starting a plan. I never actually did it, and it took Josh, who, funny enough, is also a pharmacist down the street in Concord.
Josh is your partner in Troy. I gotcha.
He was one of the pharmacists that worked at Cannon Pharmacy in Concord. Funny story, when I went to high school at Cannon School, literally like the same family name behind both. And so Josh came at a pharmacist conference and said, well, why don't you do it, man? And I was like, well, you need $50 million in capital. Where am I going to get that from? I don't have, any money. I mean, we have more than I did when I started at Medicare, which is like negative $200,000 in debt, but not quite enough to start a plan. And so he said, you know what? Look, I have my total savings right now is $1 million, and I'm going to put, if you quit Amplica and start Troy, I'm going to put everything I got. I'm going to put $1 million into Troy, and we'll start with that and go from there.
Wow.
So it's like, man, if this guy's willing to risk it all and go full-fledged, I can't, and I've been telling everybody that this is the dream and what I should do. I couldn't live with myself being like, man, am I going to do this or not? And so that kind of pushed it over the edge. And so Josh and I were both crazy enough to just go at it and start with that initial investment, and then added 170 investors after that, which are pharmacy owners themselves, including Amina and Joe Moose.
Wow.
And many others.
When did most of them come on?
So that first round, we had to raise $10 million just to get an insurance license in North Carolina. So that was the crazy thing, because we had nothing. You're really just betting on me and Josh and a PowerPoint, right? So it's a very risky time to invest.
What year was that?
2018.
That was just in 2018.
So in 2018, one by one, it took a crazy amount of effort. In fact, it was right the week I got married that we ended up, 2 minutes before the clock struck 5 o'clock, the Department of Insurance would have pulled our license if we didn't have the money. And
wow.
And it just got over the edge, and we met that and were able to launch a plan. So it was a crazy story.
When you say insurance, what does that mean, that much money?
Yeah, so let's step back a bit. So Medicare, I'm sure a lot of your listeners know, when you turn 65, or you're on disability, you go on Medicare. And Medicare, a lot of folks don't know this because they think it's a government program, but the government then turns around and gives that money to a contractor, really, to administer it. And so Medicare Part D are plans that administer just for drugs. We decided to do a Medicare Advantage plan, which doesn't just cover drugs, but we also cover hospital, outpatient, inpatient, home care, really any healthcare cost that Medicare would cover, plus more. We have dental, vision, hearing. We offer transportation to doctors' offices and back for seniors. So we're a full plan. And the reason, by the way, we went that route, just as a quick note, is if we're gonna prove that pharmacy impacts healthcare, it can't just be drugs. Do you know what I mean? Drugs are a part of health. You can't separate the two. And so by having the full pie, we're able to pay pharmacies fairly on the drug side and then leverage the savings from the health side that they drive by keeping patients out of the hospital. And that's how we're able to build a model that works by paying pharmacies for what they do. To be a government contractor, you have to go through this year-long application process that has a gajillion check boxes to check. But the first one is, are you licensed as a health insurance company?
Gotcha.
Licensing in the United States is done at the state level. So even though you have a federal contract over here that you got to get, you need the state licensure by each state's Department of Insurance to bless you and say, yes, you can insure residents of our state. And because think about it, if their concern is that if we go out of business and we don't pay claims, then those seniors are gonna be out of luck. That they're potentially on the hook for the amount. So their job is to make sure that we're a solid enough company financially that their seniors are protected.
Gotcha.
And will always be paid claims for. So that's why they won the $10 million.
Is that why you guys start more as the hub? You go out from there? That's why you're starting solidly in North Carolina?
No, we started in North Carolina because, honestly, we had to start somewhere.
Yeah, right.
And I, having grown up there, I had a lot of connections, right? Amina's there, Joe Moose is there, my partner Josh's pharmacies are there.
Yeah.
So we thought, heck, this is going to be easy. If we started there, we already have the pharmacies. They're already going to, the patient enrollments are going to be good. I already knew a couple of the people on the board of hospitals to get the hospital relationships. And we knew some lobbyists that could get the insurance license. So it's like, perfect place to start. Little do we know, North Carolina is actually one of the hardest places to start a health insurance company.
Is that right?
Yeah, because there's a very concentrated provider systems. There's a few big systems that have a very high concentration. And also, they're not like too excited or, we're too small to even move a needle on their radar.
My daughter lives in North Carolina, and it reminds me of Grand Rapids because like our hospital is like with the PBM. It's like it all seems to be like the Grand Rapids Mafia. And I'm sure you probably run into that down there then with your certain hospitals and all that stuff all combined.
Yes, as you know, it's similar to the pharmacy world. And then there's some economic dynamics, the conflicts of interest and, health insurances. Hate the hospitals hate the health insurance companies. Neither of them are evil, but they're working in this system that is messed up.
Right, for sure.
Anyway, so it's very hard to get off the ground because we were nobody. So to us to show up and say, hey, sign a contract with us, they're like, you don't even have any members. You hardly even have a license, right? We just barely got that at the last second.
Was it a ton of money just for the licensing fee? Or did you have to have so much like in assets or something?
Right. It's not a fee. So that money, they just want to have it locked up in a checking account with zero risk. Kind
of like an escrow kind of thing.
Exactly. So that no matter, even if there's a pandemic and every one of our patients gets it, we'll be able to pay claims.
If there's a pandemic every 1,000 years,
they're going to be ready for that. Right now, they're wondering, hey, do you have enough cash in the bank to be liquid? And what are the chances that you go under? And it's 0% because we have to have enough cash so that's not even a worry.
Yeah.
Otherwise, they pull our license, and we're not a business anymore, right? So this is very important from the state legislature.
You have to have a ton of money just sitting there.
if you're an existing insurance company, these barriers to entry, you got to love this, because it means that to start a health plan, you need tens, if not hundreds of millions of dollars.
Oh, of course.
How many people have that? So
hell yeah.
It makes it so hard. When we first signed up in North Carolina, they didn't even know. We didn't know they hadn't done this before. Nobody's done this before. So finding the application was a challenge, because there hadn't been an insurance license or an HMO started in North Carolina since Blue Cross Blue Shield. So
for sure,
it's just crazy.
For sure.
Here's the power of pharmacy. We were gonna start in the area where I mentioned to you, right? Amina, Joe Moose, Josh had their pharmacy, but unfortunately, despite going to church, growing up with 2 board members of the hospital, there's one person there that decides the contracts, Joan Thomas, and she wouldn't sign the contract no matter what we did.
One state person?
No, the hospital person.
Oh, the hospital to go with you. Gotcha.
Because one of the check boxes to start a health plan is making sure patients can go to every specialty. There's requirements on time and distance away from each resident's home that you have to have 48 specialties available to them, of which the most important one is a hospital.
Wow, especially being the Medicare Advantage, right? You said you wanted to have all those, so now you got to have them.
Exactly. And we were able to fill all of them except for one open heart surgery, which only this hospital does. And so without them...
She wouldn't sign off on it.
She wouldn't sign up. So we were about to again die, or this is like a moment, a step away from death.
No kidding. But
here's where pharmacy comes through. I had one pharmacist friend I knew, Joe Williams, who hadn't even invested in the plan, by the way, yet. He ended up investing a little later.
I know Joe. I did a show with Joe.
MedSmart, Brisson Drugs. He's got like 5 different things. So I was telling Joe, gosh, man, we're about to start this. Because he was asking, where's it coming to my area, which is about 2 hours outside of Charlotte.
Yeah.
And we said, look, man, we need a hospital. Without a hospital, this thing's going to die. And he said, oh, I'm on the foundation board of this local hospital over here. I'll put you in touch with the guy at the hospital. And I was like, okay, fine. Let's see what that turns into. And needless to say, when an independent pharmacy owner makes that connection, they're local. They're on the board. These people are, they know each other. They're friends. Right. So that gentleman gave me a call and said, look, Joe says you guys are doing something good and we want to be a part of it. Why do we need to get this done? It just blew my mind. We went to signing a contract within weeks.
Wow. And
we had a hospital in a county that we didn't even foresee being in. And so we were able to launch in Robeson County, which is I think is the poorest county in North Carolina, very rural, very tough, and honestly forgotten by insurance. The competition there is small because these plans, they don't even care to go in those communities to try to compete. So we launched there, and now we just this last week, we crossed 1,000 members on Troy, and we just surpassed Humana in market share in that county. We have almost 20% of market share. We're bigger than Humana in Robeson County, and that's a huge, huge accomplishment.
Congratulations.
Thank you.
When I think of Medicare, I think of government funded, and then I think of poor areas maybe having even more funding. So it seems to me, and I ain't no genius, and everybody will get in line to tell you that. No, but it seems that you'd almost do better in a poor area where maybe people are served more with Medicare. Is that not the case, even though it's a government kind of funded thing?
You could do better if you do a good job of managing costs, admission, readmissions into a hospital.
Oh, because you guys are like per head kind of, right?
Exactly. We get paid from the federal government every month. Risk on each member has a risk number, like 1, 1.1, 1.2.
Gotcha.
And so if a member has a higher risk score, we get paid a little more because they tend to be sicker. If they have fewer chronic conditions or they're very healthy, they're 65 years old, then it might be a 0.5 risk score. So we get paid more or less depending on the projected risk score. Now, if that person ends up going to the hospital 10 times, obviously we might spend 10 times what we got paid for that patient's risk score. So our job is, and therefore really our pharmacy's job, is we empower them to try to keep them out of the hospital, to try to keep them healthy, and that's how we're able to survive as a business.
I see. And part of the risk, either it's not or not necessarily have to do with economic impact. In other words, a poorer person is not a higher risk just because they're poor. Is that right?
The thing that matters the most is the diagnoses codes from the year before. So if they were at a hospital, the PCP, they coded them for diabetes with retinopathy or cardiovascular disease, those would increase their risk score for the next year. And then there is age as a factor, I think even gender, I want to say, but then also Medicaid status. So if they are on Medicaid as well, which we are a dual eligible plan, so we're serve Medicare and Medicaid members. So if they are lower income, that does add a little bit to that risk score as well.
I've seen it at the pharmacy where there's some people that, because of maybe their economic challenges, they might make decisions that are not financially always the best decision. They might go to the emergency room at the hospital more often than doing something that would maybe be, in most cases, maybe a better financial choice if it was coming out of their own pocket. And so where you might get a higher percentage, it's not going to offset somebody who, for whatever the reason, whether it's their call or not, is because of their economic situation, their costs might be skyrocketed, and you're going to get some percentage, but not enough to cover all of that.
Oh, absolutely. You're right. That's where the government, the reason we exist as an industry is because the government said, those people you're talking about, they threw their hands up and said, you know what, I don't know what we could do about it. Why don't we give it to these companies and they'll compete with each other and maybe they'll figure out something to drive down those costs. And certainly a lot of them are trying to do it by putting PCPs on and putting more on their plate to do more PCP. And the PCPs are like, oh my God, I only have like a panel of 4,000 seniors here. How much can I do with them? We're the first that says, you know what? Why don't give it to the pharmacy? What if the pharmacy can have that conversation and keep that member out of the hospital?
Now it's all coming together for me here. So
no, it's good.
All of this is working. All of this is based on the amount per person. And then pharmacists, of all the values that pharmacists bring, if we can bring the most value and number-wise, you can show that pharmacists upfront used in their best way are going to keep prices down and allow Troy to be profitable.
Exactly. That's exactly right. That's what and we've already shown it.
That's cool.
Last year, we shown that for the patients that receive an e-care plan, as you know, e-care plan through CPSN, for the patients that got an e-care plan within 30 days of being discharged, we saw 43% fewer readmissions. So the chances that they end up in the hospital is 43% less than the people who never got any touch point from the pharmacy within 30 days.
Wow. That's really cool. This whole setup. This is enlightening to me because I see it. I've been around pharmacy forever, and you see these words and stuff and Medicare plans and all that kind of stuff. And I'm sitting down here now. It's fascinating to really think about that and what the pharmacist can do.
It really is. I hope more folks do this, honestly. I think there's room for 10 or 20 more of Troy Medicares.
The problem with pharmacy has always been where pharmacists would save money, but they wouldn't get remunerated for that. And then maybe the healthcare plan would, but it wasn't helping pharmacy at all. But with your guys' thing, what was I reading, Flaviu, that there was incentives for the pharmacists to be doing this too, right? What are some of those incentives that that an independent pharmacy would say, this is cool?
There's 3. Right. So number 1, Troy's the first plan to put them in the preferred network and leave all the chains out as non-preferred. So what that means is if you fill a statin on Troy or lisinopril, if you go to Mike's pharmacy, it's $0. But if you go to CVS, it's $10. We're the first plan to do that, which is honestly just their own medicine, back to them. That's what they've been doing for a decade.
Why is it allowable to have preferred in Medicare? It just is?
Yeah, the Medicare forces all pharmacies any willing provider to participate. So while in a private plan, like a commercial plan, PBMs could just kick you out of it and force everybody to go to CVS.
Right.
The federal government said, no, you can't kick Mike out, man. You can't make a senior drive 3 hours to go to CVS. They got to be able to go wherever they want. And so that's when the brilliant minds behind PBM said, well, what if we have a preferred and non-preferred network?
Gotcha, the tiers.
Well, they can go to both, but the copay will be different. And so they snuck that one past CMS. If chains can show that they bring the same value as independents, let's say, you know what? Leave them be in a preferred network. But if they don't, as long as the experience at Walmart is what it is, and experience in buying is what it is, they're not doing e-care plans. They're not doing free delivery. Only with the pandemic, they were forced to do free delivery, right?
Okay, so that was one. The different copay levels.
Exactly. 2, we pay pharmacies $30 per member per month for care management to take clinical actions. They keep members out of the hospital. That e-care plan. So whenever they complete an e-care plan, we pay them $30, which $30 might not sound like much, but over the course of a year, that's $360. And then say you have 100 patients on Troy, which we have pharmacies with 200 plus. That's $36,000 a year. 200 is, what's that, $72,000 a year. That's starting to be, real money, which, by the way, these pharmacies are already doing this. So they're really getting paid for things that they're already doing, right?
Exactly, right.
So that's 2. And then 3, we're the first Medicare plan to have transparent drug pricing. What does that mean? So all of our pricing is based off of NADAC, which is a publicly available pricing. A lot of state Medicaids are starting to use it because they're tired of getting tricked by PBMs. So they're using NADAC, which is published every week on the Medicaid website. And so that way, patients know what they're going to pay. Pharmacy knows exactly what they're going to get paid is NADAC plus $10 for generics and $4 for brands. And that's the difference. If you fill lisinopril on Aetna, you might get 50 cents, 30 cents. If you fill lisinopril on Troy, say the NADAC is 30 cents plus a $10 dispensing fee for your work, for what you do. So now it's $10.30 for a generic. Again, we're trying to incentivize generics, not brands, which is a huge difference between other PBMs who would rather pharmacies fill brands because they make more money on rebates than they do on generics.
That's ridiculous. What a broken system.
Yeah, so that's that. And look, as you know, for an independent pharmacy owner to have that transparency, they know there's no DIR. So when I mentioned NADAC plus 10, that's it. It's not NADAC plus 10 minus 4.5% if you achieve a 3-star rating between December 31st and June 2nd. It's not that.
Yeah.
It's just straightforward pricing for drugs plus care management for actual value.
I imagine back in the day when they talked about DIRs and those kind of things, star rating, that was probably to say, I don't even care to know much about it anymore because I know it sucks. But I think it was kind of to get certain levels of care and stuff from the pharmacy. Playing devil's advocate, what if a pharmacy says, sure, we're an independent pharmacy, we'll sign up. We're going to take advantage of Troy by being independent, but we're not going to give good service and we're not going to do this and do that. Does the e-care plan sort of do enough to protect Troy to say, no, anybody that does one of these e-care plans has to at least have done enough to make some impact? Does that guarantee something or not necessarily even? Because somebody could just fill in the blanks for that pretty much or go through the motions.
You're right. So that could happen. Or like you're saying is even better an example, they might just not do anything. And I won't lie to you, there are pharmacies like that, to be honest with you, today in our network.
They could fill and get the higher filling costs, but not even do any of the care plans, and they would still take advantage of being independent.
They could, and they are, some.
I'm trying to find ways to be sneaky so when you come to Michigan.
No, this is why I love capitalism, because you're right. People can do that, and that's their incentive. But what's going to happen is that some of those pharmacies are starting to have 100, 200 members onto Troy. And so there's the economic incentives. They're starting to look at, like, here's one example that actually we just saw the other day. We had a pharmacy that honestly didn't even participate in trade. They're doing some other lucrative thing I won't go into. And they're like, you know what, we don't need Troy. We're fine. We're doing great as it is. We don't care about your plan. We're not going to do any of this. And they literally had 0 patients onto Troy. And they're an independent. I know the guy. And here's what happened. They happen to have one that somehow ended up on Troy through the whole thing. And one of the things we do as a benefit to patients, we give them $1,100 a year in an OTC card.
I saw that.
So this is a debit card, a MasterCard that they can swipe for health items only at their independent pharmacy, or honestly, they could do it online on Amazon too. But we try to like push them to do it at the local pharmacy.
Sure.
And so it just one day, this person walks in with their debit card and says, "Hey, I have this debit card. Can I buy some stuff?" And they're like, "Look," and I kid you not, the next moment we know, the pharmacy owner calls us like, "Dude, I just had a patient over here with that Troy debit card, and they bought out my whole front end. Like, I literally, because they only have like 1 or 2 of these things, and they bought literally everything they had to buy off the shelf." And it just clicked in that pharmacy's mind that, holy shit, this could be a really good thing for the pharmacy, because if I have all these members buying health items with their OTC card, I'm going to make more of a profit in the front end.
Yeah.
And now they're getting more engaged. They're getting more folks on Troy, right? So now they're really involved. And I think for each pharmacy is going to be something different when the moment clicks, like, wait a second, this is good for us. It's good for them. I'm making more money. They're healthier. It's better for the system. So I think if you line up those incentives with enough education and time, eventually folks will fall in and do it.
I agree. And there's enough pharmacists. I mean, pharmacists have been screwed so much that even if you told the pharmacist, if you said, all right, we're going to pay you, and I'm not saying you're saying this, but even if you did, if you said, we're going to pay you X, and you can either spend 10 minutes per prescription in your mind bitching about how bad PBMs are and all these plans to like blow up their headquarters and all this kind of stuff. You can either think of that, or you can spend 10 minutes physically talking to the person and doing this and whatever, and we're going to pay you at least for that time and so on. I mean, you can make this thing kind of break even almost for a pharmacist. And if they said, oh, you mean I get to spend time in a positive, at least doing something that feels good, even if I don't get paid for it, versus thinking about how I'm getting screwed. Both of those take 10 minutes. Pharmacists would give up a lot. Well, you see it right now with the pharmacists working their ass off with these vaccinations. I mean, they're working their tails off, but they're happy about it because it takes the focus off getting screwed for the last 10 years.
You're right. There might be independent pharmacies that maybe they're close to retiring and they don't do it even with the incentives. But that's why independents work, right? Because if one won't do it, you or Amina or Joe Williams is going to buy them out. And another independent will start and say, wait a second, I can make $30 PMPM times this, and this guy's doing none of it. I could expand this business EBITDA by $200,000 in overnight. Wait a second, it's worth buying this pharmacy from them, right? And so economics, when you're not dealing with a monopoly and an entrenched interest, I think it'll work itself out where the people who actually do this stuff will be the ones that are the future of independent pharmacy.
Right. What's OPM 56 mean?
It's a Harvard program for executives to go under. So I did 1 year of that to try to sharpen my business experience.
What's that stand for, OPM? Is that just the name of the course?
Owners and Presidents Management, I would say.
Was that online?
No, it was in person a year before the pandemic.
Oh, it was? In person to Harvard?
Yeah. You
had to live there for a year?
Yeah, well, part-time. It was, I think I lived probably there a total of a month and a half. So it's kind of on and off, because you got to understand it's a program for folks that already either are executives or own a business.
Oh, they know that you're already busy and stuff.
A lot of the coursework, but really, really put into very little time. So it's quite overwhelming, actually, and humbling.
A guy like you, it's not terribly important for you to have this kind of information behind your name. So I'm thinking that this was very valuable to you. Would that be a fair statement? I mean, it's not like you were trying to use this on your resume to say that you had this Harvard course. You must have really have thought there was a ton of value in it.
I could have done a better job in the way I ran Amplicare, and I'm taking a lot of those lessons into Troy, and now Troy is already surpassed Amplicare in terms of size, and it's a different business, of course, but the skills that it'll take to take this, we're not building this to sell it to Aetna, in a couple of months, right? We're building this to truly replace Aetna, and for that to happen, my skills need to grow with the company to a level where we can legitimately become a public company, right? And I've never gone through that process, so I got to learn from the people that have, and try to do my best to shepherd this company on the right path.
Knowing what you know now with all the schools that have gone online and stuff, would you still have done it in person? Was that cool just to be there and do that in person?
Oh yeah, the biggest value of the program, even though the coursework's amazing, the teachers are out of this world, but by far the biggest value is really the other students, so to speak. They were all like business owners in
right.
100 countries around the world, so not just in the U.S.
Yeah.
So learning from the way they do things there, we're talking people with like massive businesses in other countries. So learning how those people think and those relationships really is probably the most valuable part. And you can only do that in person. So in fact, that's why I haven't completed it. So I'm still in the middle of it because I didn't want to do it online. Most of my class didn't want to do it online, so it's kind of been on pause until probably this fall is when they'll do it again in person, and I'll continue.
They have people coming from other countries for like a month or whatever living at Harvard doing that.
Exactly. And yeah, you're in these little pods, but yeah, these people come from Australia and from Indonesia and China and all over the world. So and they're all in this one building together.
How long did you think about doing that?
A couple of years.
Really?
It's A, very expensive, and and B, it took a friend of mine did it, and he was just really, really raving about it, and that made me pull the trigger.
What's your ethnic heritage?
I'm originally from Romania.
Romania. I
grew up in Romania. I played tennis actually every day since I was 5 years old until the age of 14 when I moved to Concord, North Carolina, and continued playing tennis there. So that was, I came through, have you heard of Rotary International?
Yeah.
So my dad in Romania was a part of Rotary, and this woman named Susan Smith was in Rotary International. So they came, visited us, and through this exchange program through a Rotary International program is how I got to move to Concord.
Was tennis part of that? You were like on a tennis exchange or something?
It was supposed to be. Funny story is Susan was a Rotarian.
Yeah.
She's married to Bob Smith. So Bob and Susan Smith, they have no kids, no knowledge of tennis. So they found this family who did and had a kid who plays tennis and were willing to do an exchange type program. And so that person agreed. And I was on my way on July 4th, 2001. And at the last minute, the person called and said, "You know what? It's not going to work for us. We can't do it anymore." But Susan, they had arranged this whole thing. Kid from Romania is already on the way, so they, which now they're like my second pair of parents. They're just, in fact, I want to see them tomorrow for dinner.
Really?
And they hosted me.
Are you a tennis pro?
So I played tennis. In high school, stayed with them. That turned into college. After college, I tried to play tennis professionally for a year, and I got to be like 1,300 or so in the world, which is also known as the stage where you spend all your money and have nothing to show for it. So after a year of that, I said, you know what, tennis is not for me. I'm like pretty good, but I'm not as good as it takes to make it in professional tennis.
In my city, people talk about, oh, so-and-so's really good at baseball, or so-and-so's really good at swimming, or something like that. And they never quite get there. Some make it up there, but as far as like the top of the top, things are so competitive.
I have buddies, they were 200 in the world, 150, and couldn't make it. And now they're, teaching pros in, various clubs. There are only maybe 40 or 50 people that make it out of, I don't know how many tens of thousands are trying every year.
I suppose business is like that too sometimes, because you think that, I don't know, it's kind of like, you ever watch American Idol?
Yeah.
The reason those people can get out there is because music is subjective. There might be some people that think they can sing, but it'd be like me going out to play basketball against Shaq or something like that. It's just objectively, it's just not going to happen, you know? But there's certain things like singing, but I think business is like that too. There's some business people that think that they've got skills and maybe they think there's more luck involved or something, but think about the real good business people in the top 10. Think about them being like in the top 10 of tennis and just think how good they have to be.
And I think it's got to be their bliss doing it. You know, it's got to be something that you do with such passion and ease that you don't even think about it like work.
Right.
You know, and for me, I mean, tennis for me was really hard work. I would get off the court and be like, let's have a beer. Let's relax a bit. Meantime, the other guy would go, you know, running with weights around their ankles for 2 hours, you know. And so you could just tell that they had a level of passion for it that I just didn't. Whereas what I do now, honestly, I do this every day without having to, because I'm so passionate about taking out United and Aetna that I'll work in as long as it takes to put those guys out of business. And I think it's the same with basketball. You know, you see Steph Curry, he was like probably my size, right? Your size. But yet he's so passionate, does it so, and he's got talent. But I think it takes that passion to really do it.
Let's say that it wasn't pharmacy, but you still had your skills of business and computer and things like that. Let's say it wasn't pharmacy. Do you think you could have latched on to something with as much passion just because you like the hacking of things? Or do you think there was something special about pharmacy? I mean, could we be sitting here talking about car parts or something if your friends were in the car business?
Maybe. I think you're right. It's I think a part of it is how you were raised. How I was raised was like Bob and Susan, for instance, who took a chance on me being just a kid and giving without expecting anything in return. And some of those acts of generosity set me on a path where I knew what I had to do had to help somebody, had to have some meaning of beyond myself. And so could it be car parts? Maybe.
You could have done that in car parts, but it's maybe one more segment removed. Like you could say, I'm going to do this with cars so that people can enjoy family vacations. Well, that's true, but it's maybe one more stretch of saying I'm going to make sure that my heart is healthy so I can enjoy being with my kids or something. That might be just a closer, an easier way to see the good that you're doing.
Absolutely. I think, like I'll tell you, before I met Matt and started on Medicare, I already had quit my job. I worked for the University of North Carolina, Charlotte in IT, and I said, you know what? I got to do something more meaningful than this. So I quit my job without having a real plan, and the first business I tried to start was called Eval Me, and it was Survey Monkey?
Yeah.
So this is early days, and so I thought, I'm going to build a survey tool that, you know how you get these surveys after you like rent a car, Hertz sends you a survey like, hey Mike, what'd you think of the rental?
Right.
So my idea was that when they send that survey, you say, because you're going to throw that away, you're not going to fill that survey. So instead, you say, well, Mike, if you complete the survey, we're going to donate $1 to charity, and you get to choose your favorite charity that Hertz will donate to. And so that was my idea, and I built the whole thing, and I went to all these big I got the charities on board. They were real great.
Yeah.
But getting to companies, they're like, wait, so I sent a survey for 10,000 people, I got to donate $10,000? It's like, yeah, that's how it works. Like, no way we're doing that. So eventually it died. But it gives you an idea of like, that's what I wanted to do. And it felt good because I knew through that technology platform I would be at least helping in some way, You
were always probably doing good for ultimately something, but you needed a closer connection.
For sure. And I just feel like this is one where you see you can't not be passionate about it. You know what I mean? You see these guys being obliterated by the forces of a few companies. It's just not right.
It sounds to me like you've always been an entrepreneur or someone that wanted to build that. When did you realize that you were going to be having your own companies? Well,
yeah, I think my dad's entrepreneur. He had a restaurant in a hotel in Romania.
Yeah.
So I worked around the business all the time, and cleaning up and doing whatever's needed. And then in the US, and I went to college, I started, web hosting, right? So in these early days, you have a website, you had to find a place to host it.
Right.
And when I'd gone to college at Davidson College, one of the things I did, and actually I went to college when I was 17, so I wasn't quite 18 yet, but I started this web hosting company that was actually using the servers at the college for the hosting. So,
really?
So when you would buy the website, I got in trouble for this because you would buy the hosting, but it was actually hosted on the school servers, and
you were borrowing it.
and then also I was 17, and I one of the things was like, we offer customer support, but it's just me, and I would be a class or something.
Yeah. So
they couldn't reach the number, wouldn't go to me. So eventually they tracked me down, and these customers tracked me down and found Bob and Susan actually, and they called them. They're like, "Hey, what's this website? I need some support for this hosting company." So it all eventually had to shut down. But it just got to give you an idea. You know what? That's just the kind of thing that I'm into. Try to start some way of starting a business.
Was part of that saying you didn't want an hourly wage? It was always like, this is fun. Or was it like, if I don't do this, I'm going to have to work?
No, I think it's a financial thing. I think it's always, I think it's a financial and freedom thing. When I quit my job in the Eval Me charity thing, as you could tell, that definitely wasn't paying the bills.
Yeah.
So
yeah,
I was freelancing, being a programmer, which you still get paid, hourly or per project as a freelancer. But I remember feeling that freedom of, I could work at 3 a.m, or I could not work at all today, or I could work all day if I want to. But having the freedom was really something that I think entrepreneur gives you, right? I think a lot of jobs try to lock you into 9 to 5. You're here every day. Less so now. It's interesting how that's changing.
Yeah, really quickly.
That lack of freedom to me probably was the biggest constraint in having a job, and even to this day, Troy actually doesn't have any mandatory kind of hours or office. We do have an office, but nobody really goes to it, even before the pandemic. We're a fully remote company.
Wow.
And I just think that having that freedom will get you employees that know how to self-manage, that treasure it.
Right.
You know what I mean? That they don't need like a lot of instructions or confinement to do their job. But
one of my daughters just, she got a job, and now she doesn't have that job already because it was some marketing. She was marketing for a guy that did SEO for home repair, something like that. Anyway, it was from home, and the guy had on his computer one of those that tells you how many screens you've had up and how much action's been on your screen and all that. He's like, you're only 60, you're supposed to be 85. She's like, I quit. She said part of the benefit of being from home was that, this is not her words, this is my words, but I get to screw off a little bit. Not screw off. Have some freedom. Have some freedom to go to this website or do this.
That's how people work.
That's how you work.
Look, sometimes the best idea might come, while you're walking your dog or in the shower. We're not machines here. Anything that is that easy to automate should already be automated by a computer already. Yeah. Right. So if you need a human to do a job, you need somebody to think creatively.
Yeah. Right.
And that can come in 1 minute in a day, or you know what I mean. It can come at night.
All different times. Speaking of which, your website says AI driven. What do you mean by that with Troy?
So here's what is really exciting about what we're building is, sure, we're empowering pharmacies and we're growing this, and it's going to put Aetna out of business. But I think even more beyond that, being a health insurer, we are able to have more data than any other party in the healthcare spectrum. Think about it. We get data from pharmacies about claims. We get data from hospitals. Every time somebody goes into a hospital, we get labs data about blood tests patient got. We even get data. Just last week, we started getting continuous glucose monitoring. So I get blood sugar level data for our members. We have smart scales and blood pressure monitors. So we get real-time scales, weight data for our CHF patients. And so you combine all these data sources, which again, nobody across healthcare has. So our job is to first, ingest it, make sense of it, and then feed back insights to point of care. So I could tell a pharmacy, even simple things. We're the first to tell a pharmacy that one of your patients got into the hospital. That's in the hospital right now. Nobody's has anyone ever told you that before? Has any health plan ever said like, hey, Mike, Mrs. Smith, who you see every week, she's in the hospital now. Maybe we don't need to fill that medication for her. Maybe we should check in with her when she gets out. That's the simple kind of data. But now we're starting to say, you know what? Based on all of these biometrics, we actually start forecasting that Mrs. Smith needs a cane. Maybe, she's on certain opioids.
Yeah.
We actually we notified the pharmacy to fill the Narcan for the person, and then the next week, her daughter found her on the floor, was able to use the Narcan and saved her life. And it came from a pharmacist action. So our job as a plan isn't to be a plan. Honestly, we're just another middleman. And our ultimate job is to extract ourselves from that being middleman. Our job is to provide you with the data and the insights so you can just be a rock star pharmacist and a rock star PCP, and the patient has the data they need about which PCP to go to. So that's ultimately the job of Troy. It isn't to be, robbing Peter to pay Paul. It's really to provide the data and insights, and that's what we refer to Troy AI. So ultimately, that's kind of the end goal, Mike. It might be a little too idealistic, but I just think that's our job.
I was reading an article. Well, it was a blip online about Apple, and he was saying that if you back up from Apple and then focus back in, Apple's going to be known as a healthcare. Yeah. Well, I don't know if it's a healthcare company, but if you come back in, Apple's going to be known as health. Mm-hmm. Like if you look at Apple in 100 years, you're going to think Apple was health. And so just by different things, the AI stuff and all the stuff we're talking about here and all the touch points it has, with things.
I hope so, man, because healthcare needs, a lot of these devices in healthcare, they're really crap, man. If you look at the quality of an iPhone, right? And then you look at the quality of a blood pressure cuff or even the blood strip test, that is crap, man. We could do with our technology today, we could do a heck of a lot better. I have a CGM on right now. You see on the video? I have a Freestyle Libre on me right now, and I can already tell this thing expires every 6 hours. I have to scan it. So if I sleep more than 6 hours, I'm missing data. It's huge. You could make a smaller form factor. So I hope Apple does it, but somebody needs to actually make devices that's like an iPhone for healthcare, because right now our devices are nowhere near that level of quality.
Anybody who was 100 years before me, I always think they were stupid, and that's not true. I mean, there's people.
What about Abe Lincoln, man?
Isaac Newton. Come on, those guys. He invented calculus. I don't even pronounce it right sometimes, But those guys were freaking geniuses. But I always look back and think they were stupid. And people are going to look back the same way to us. They're going to think that we just didn't know what we were talking about when they've got all this cool stuff in the future.
Yeah, I agree.
If you were an evil genius, what would be tempting to say, I wish I could go back to this model? It'd be so tempting to do DIR rebates or something like this. Or in the future, what could you do that would be really damaging with the stuff you have? And I'm not trying to brainwash you so you become this person. What are some things that could be tempting if somebody started to have more people underneath them?
Oh, for sure. It's the reason these health plans end up as they are is not because they're evil people. I think it's the natural progression of things. You get bigger, There's only so much you can do, so you focus on the things that drive the most profit, and you optimize for that. And you're a public company, right? So if we become public, there's going to be some hedge fund shareholder that'll be like beating us up probably over squeezing more profits out of everywhere. And inevitably, they're just forced to compromise on our values.
And then they come back a year later and they say, do it again, right? I mean, every year they want that raise.
Every quarter.
Every quarter, yeah.
So I think there's so many places we could go wrong. And I see it, we have a PBM we use now, and we see how things can be improved. And we have so many vendors where we can see things can be improved. And each day we have to choose, hey, what are we going to focus on? We're not going to be able to change all of these today. So which ones do we pick? And I could see how as you grow bigger, you might be defeated and say, screw it, let's just leave it as it is. The customer service is kind of as crappy as some of these other plans. Ours is just slightly less crappy, so it's fine. And it's kind of stopped trying to really do the right thing because of the bar being so low in the industry.
That's interesting.
Like you see, even as we're talking about, rebates, a lot of things we can't do in our bid. The way these Medicare plans bid every year, rebates and DIR fees are lumped together and they help your bid be better. So when you take out DIR fees and we want to do away with rebates, they say, well, you can't bid the plan. You'll be non-competitive. There's not enough dollars to be competitive. So it's tempting to just say, okay, well, fine, I guess we got to do it too because they're doing it. So we got to do it. And that's just not okay. And also, you asked about a co-founder. This is why it's great to have Josh, because Josh is someone who when put in that position, he'll rather, blow up, turn the table over and shut it all down than compromise on his values.
I'm glad there's at least one honest guy in the company.
You made me an evil genius.
I forgot. This isn't you. This is the evil genius. Sorry. I shouldn't have said that. That was rude of me. Yes.
Who was it? Oh, the other day we said, hey, why is Lantus so expensive? Doesn't Lantus have a generic? And we asked the pharmacist, says, I don't think so. I don't think there's a generic for Lantus. And Josh's like, man, I sort of sworn there's a generic for Lantus. I'm like, well, let's look it up. So they do some research, and sure enough, there is a generic for Lantus, but it's on 0 formularies, not one form. I'm like, man, Lantus is $300. Why is there no generic? So we ask our PBM, hey, can we put this generic on the formula? And they're like, well, you're going to lose all the Lantus rebates. And look how many Lantuses you're filling right now. And Josh is like, look, man, the only reason they're filling that Lantus is because there's no generic. Like, if there was a generic, we'd just switch them all to the generic.
It's a joke.
And they're like, well, you're going to lose your rebates. Well, how much are rebates? Well, they're out of 300, maybe $150. Okay, well, how much is the generic? Oh, 100 generic's like, $130. So you're saying I'm going to get, $150 of cost to something that would have been $130. So, like, I literally could save money. But this whole myth of the rebates and the brand,
what a joke.
Thing where if you're not fighting it, you're losing. So you constantly got to be on that. And even within your own company, that's what I'm trying to tell you. This is within our own pack of vendors that you got to be watching it like a hawk, or else you go back to the way everything else is,
Almost every day you have to live with the expectation that everything you're doing is going to come to light and come to light quickly. As far as I was just talking the show today that was out about the whole Me Too movement and all of the comedians now that are getting in trouble for all their, and rightfully so, their things that aren't comedy, off stage, antics and things like that. And it's like that all came because of just openness, and so you almost got to run everything you do with like, all right, what's the best move if everybody knows about this like tomorrow? Because they're going to. And so you might as well stay ahead of the curve.
That's right. And it's a competitive advantage. I think because of the lack of transparency from our competitors, our transparency stands out, right? Like, we published our drug. You can go to our website right now and type in Lantus or any drug, and it'll show you the price, which sounds like any other website that has anything you can buy. But in the pharmacy world, that's like mind-blowing that a plan would do that. So I think you're right. Transparency is the way to go, and it's a competitive advantage. And I hope that's my end goal. I think if we succeed, it'll pull the other plans along. Well, they'll have to be transparent. They'll have to pay for care management fees. They'll have to reimburse at NADAC plus 10 without DIR fees, because it's just a better way to do things.
What's next on the expansion? What's next to say, all right, now we're in South Carolina? How does that go then from here?
That's the plan. We're expanding to 18 counties next year.
Your bottleneck, is that just finances? Just getting more infusion of money?
It's two things: finances and hospitals, hospital relationships.
That's right. Hospitals that'll partner with you.
That's what I've learned in the last 2.5 years, Mike. Those are the only two things that slow this business down. And it's regretful because I have so many pharmacy owners that call me up and say, hey, when you come into Kentucky, like just today, somebody messaged me, when are you coming to Kentucky? When are you coming to Kentucky? And I wish I could be there this open enrollment, but it's two things. First, I need 10 million at least to enter a state, as you see in North Carolina, which I'm working on to build at least 2 more states next year, and then hopefully 2 more, and continue that growth path. But then more than even capital, I'll tell you, because now that we've proven the model, capital is starting to be a little easier. But those hospitals, man, that is a one-by-one relationship. Just because I have Duke Health now in the network, but I go to Tennessee, you think Vanderbilt cares that I have Duke in the network? No, they don't care. They're like, do you know anybody at Vanderbilt or do you not, right? So those relationships take time to build. And where a pharmacy owner or somebody in your show has them, that would speed up our entry into an area considerably. So that's what we need.
What do the hospitals, why do they take so much finessing? Is it because they don't want to deal with something new, or they get so much incentive to not deal with you and more with just sticking with the traditional malarkey, or what?
Look, you don't really get, you have to think from their side. They're running oftentimes a $2 to $10 billion health system.
Yeah.
Right, that serves the community during a pandemic with thousands of providers, right? And so there's a lot of priorities. There's commercial contracts that pay 4x what Medicare pays. They're dealing with Medicaid change, which is pulling on them from every way. And then I show up and say, hey, look at this innovative model with pharmacy. Yeah. Don't you want? I'm like, man, and it's not that they don't want. It's like just one more thing that doesn't seem to really move the needle for them. Because think about it, for us to... They do hate United and the plans too, but for us to show that we're an alternative to United, we have to prove that we can sign up as many people as United has.
Right.
And United's got 50% of the market. We have 0. So the question is, do they believe that I will go into a market where United, the largest healthcare company in the world, or Aetna, has already dominated and squeezed every Medicare life out of there they could. So they believe that me and a pack of pharmacy owners are going to be able to enroll those people from United and Aetna back onto Troy. And oftentimes I think now they're slowly starting to believe, because they see it in North Carolina, and they're saying, well, you guys are actually doing this. But think about it. No plan has been able to do this before, because, again, it's so hard to compete with these guys. They already pay all the brokers. They have all the ads. They got billions of dollars in Google and Facebook. Like, you can't compete with them. The only reason we can compete is through the pharmacy channel. And I think once we prove it one by one, folks will start seeing that it just takes a lot of work to show it to them.
You had mentioned that relationship is important between the pharmacies and the hospitals. Mm-hmm. Can pharmacies help out at all? Is there any way that you're letting them know, like, here's where we're trying to go? If they know now that that's the big thing, and assuming they don't have $10 million, but they might have a relationship with a hospital, can they help at all?
You're absolutely right. That's what's if they have a relationship with their local hospital, where we could get in a foot in the door, that is worth the most. So they should just message me, and we can, at this point, prioritize the state that has it. It's really important that it's a hospital that has heart surgery. Like I mentioned to you before, the way the CMS system works is they require you to have a place where a person can have open heart surgery. And there's not that many open heart surgeries that happen in a year. So the only hospitals that tend to have it are the bigger ones or the academic ones. So luckily for me, the Joe Williams Connection Southeastern had heart surgery that they do there, and that made the world a difference. So if your pharmacy owners have that relationship with hospitals around them, especially ones that do heart surgery, they could call me now, and we can start going there.
You might even keep a mini database either in your head or on paper. Say, hey, I got 10 people just messaged me and they all have a connection at ABC Hospital in Minnesota or something. So we might be looking at Minnesota now or something like that.
Exactly. The best thing they could do is, if they're not already, to donate to the hospital's foundation, start showing up at their events and being connected to that, because that, honestly, that'll help certainly with Troy, but it'll help with their own business. If you're trying to do a 340B contract with them, if you're trying to do a clinic, any sort of pharmacy program, meds to beds, all of that happens through that, from the hospital leadership.
Yeah, that's good advice. All right, Flaviu, thank you so much. That was really interesting.
Hey, thank you, Mike. Appreciate you having me on.
Boy, the pharmacies are waiting on this, so they're going to be really watching. So really cool. So thanks. We'll be in touch and we'll be watching. You've been listening to the Business of Pharmacy podcast with me, your host, Mike Kelzer. Please subscribe for all future episodes.